Thank you for joining us today. As we get closer to the one-year mark of our fight against COVID-19, more and more Idahoans are receiving the groundbreaking vaccine, and the end of the pandemic is in sight. Our goal with COVID-19 vaccine planning and distribution is, in part, to reduce transmission, preserve a functioning healthcare system, and get back to normal as quickly as possible. When it comes to the vaccine rollout, the government plays a role and the providers play a different role. The state of Idaho ensures providers receive the doses, and the providers ensure the shots get in the arms of people who want it. No doses are shipped or stored at the Idaho Department of Health and Welfare or any other state entity. All doses allocated to the state of Idaho are shipped directly from the manufacturer to the local public health districts and enrolled providers as soon as they are available. Over the past 45 days, more than 89,000 Idahoans have received at least one dose of COVID-19 vaccine. And I want to thank those healthcare workers, teachers, and others who have taken this important step to get us back to normal. We are working hard to ensure that COVID-19 vaccine is administered as quickly, fairly, and safely as possible. I increased the number of available National Guard personnel to assist in vaccine administration. And we recently rolled out new grants to ensure healthcare providers have no resource barriers to administering vaccine as quickly as possible. To ensure transparency in where vaccine doses have been given in each county, we have made a vaccine dashboard available at coronavirus.idaho.gov. But there is more we can do. There are questions about whether vaccine is being administered quickly enough after it arrives in communities across Idaho. And quite frankly, we need a clearer picture. To shine more light on vaccine administration and improve transparency about where the vaccine is available across Idaho, today I am signing a new executive order. It's called the Transparency in the Administration of COVID-19 Vaccine Executive Order. My executive order requires health districts and providers to regularly report the number of vaccine doses that have been allocated, how many shots have been given, and how many doses they have in inventory to ensure vaccine is getting out in a timely fashion. We will be able to see in practically real time the number of doses each provider has received, administered, and has in inventory to demonstrate our commitment of getting out doses as quickly as they come to Idaho. We owe it to Idahoans to get shots in the arms of people who want it within 7 days of doses coming into Idaho. If it appears a provider is not administering their allocated doses quickly enough, we will step in to ensure they speed things up. I will review this information daily to ensure that doses are distributed equitably across Idaho, and that providers and public health districts have the operations in place to be able to give shots within 7 days of the doses arriving. I am also actively working with our Idaho Public Health team to make all this information publicly available for Idahoans to view online by Monday, February 8th at coronavirus.idaho.gov. On February 1st, the 65 and older population can begin making appointments to receive vaccine in Idaho. This is a big step to keep our seniors safe and healthy. But I want to be clear, there is still a big gap between supply and demand at this point. The senior population in Idaho includes more than 265,000 people. Idaho currently receives just 24,000 first doses per week. Based on our current allocation, it could take 2 months for eligible people to receive their first dose. So I ask, please be patient. There are some providers in Idaho that are ready and willing to receive more doses of vaccine. I want to thank those providers across Idaho that have met the demand and stepped up to help their communities. When it comes to our anticipated supply, I want the people to know we are pressing the Biden administration to make sure Idaho receives more doses of vaccine as quickly as the supply chain can be ramped up. All these steps should give Idahoans confidence that we are actively addressing any challenges we have identified in getting the safe and effective COVID-19 vaccine administered in Idaho as quickly, transparently, and fairly as possible. Thank you. With that, I'll take your questions from the media.
Scott Logan with Channel 2, sir. Are we being called on? Can you hear me?
Yep. Speak up, Scott.
Okay, I'm screaming into my microphone out here. Governor, just last week you made a direct appeal to the citizens of Idaho to contact their legislators and urge them to stop efforts to rescind your emergency orders. You talked about some severe consequences if the legislature continues as they are. What have you heard about response to your request to the citizenry?
Well, I've heard some things, but this week and today, I am focused on vaccine distribution, on getting the vaccine out, on getting our COVID numbers down. I addressed that last Friday, and I don't want anything we do here to diminish the importance of what we're doing right now. That's going on, but building Idaho's future, getting the spread of COVID down and getting vaccine out is what I think is most important to me and to Idaho.
But sir, a follow-up, you said though, what happens at the State House could jeopardize exactly what you're talking about right now, the rollout of the vaccine.
And I stand by that, but like I said, I am focused on vaccine distribution. If you look at the way I'm spending my time, what I'm doing, that's what I'm focused on, is to get this vaccine out. I think so many problems in Idaho go away if we go back to normal, and I think that's the goal of everybody in Idaho, and that's why this vaccine distribution is so important.
Thank you, sir.
Melissa.
Hi, Governor. Thanks so much for doing this. I was curious about your administration's discussions with the Biden administration, and if you can give us any insight into whether efforts to increase the doses allocated to Idaho is going to be successful anytime soon, because, you know, as you said, we're getting just about 21,000 first doses every week, and it's going to take a heck of a long time to get all of these Idahoans who want to get vaccinated taken care of.
Yeah, Melissa, I had a call day before yesterday with the senior management in the White House and CDC, and there's some people that I'm communicating with that I had a relationship with in the old administration. And there's really two things, or actually three. There's a consistency of supply, and they committed that unfortunately, that the number of vaccines we get this week will be the same for the next 2 weeks. And they did raise that up by 16%. So we're going to get about 24,000 a week is what they're scheduling. There's a second part of that issue of ramping up after that, which all the governors are interested in, because, you know, not only Idaho will not get to where we want to be in early summer, none of the other states will. But the third part of that is Idaho's share. And I've actually been in communication this morning with General Perna, and one of the things that they talked about is that the distribution would be on a per capita basis. Well, it's per capita adult, and Idaho has the second highest number of below 18, and so that's one of our issues and why we're not getting, because I kept doing the math on per capita and going, hey, this doesn't look fair. That's one issue. And then the other issue is, when did they take the population count? If they do the current July 1 population count, we would get more, but we're continuing to have that dialogue with this administration.
Thank you.
Audrey.
Hi, Governor. My question is about the federal pharmacy partnership with CVS and Walgreens for long-term care facilities. Will the new transparency data, will that include doses that went through that program, even though it didn't quite bypass the state, but it's more of a private federal partnership? And do you know why only half of the facilities that had signed up for that program had gotten their first doses as of last week? Are you hearing anything? Are your health officials hearing anything about that?
Yes, that is one of the issues. But I did just yesterday, CVS, which is they are not doing anything in North Idaho, but in Central and South Idaho, and they have literally. I got a note from them yesterday. I don't know if all the reporting's into our system, but everybody that they're in charge of has gotten at least one shot. Walgreens, the other contractor, we haven't heard from them, but you're exactly right. They've been a little behind in their reporting. The way I don't want to complicate this, but they report into their own system. Then they go to a third party and they do some work on it. And then it goes to the federal system and into ours. So there's a delay in that. But they both committed that they would have everybody, all the long-term care residents that they were accountable for, have their first vaccine by the end of this month. And I have no reason to disbelieve it, but I think the reporting is lagging. I know the reporting is lagging.
Yeah, that's been the case with a lot of things during this pandemic with data. Thank you so much.
Kyle.
Hi, Governor. Thanks for your time. I wanted to ask a two-part question about your executive order. You said that you'd commit to having vaccines administered within 7 days of them coming into Idaho. So I'm wondering, how long are vaccines sitting unused in Idaho right now? And which providers are having a problem giving doses in a short time period?
Well, I will tell you, Kyle, in your area, the dashboard which is kind of a draft dashboard that we're going to have, had that first dose administration in your area. Some of it's at 99%. I've got other areas where they're behind, but part of the issue is some of the health districts and some of the providers want to have these big events, so they were saving inventory to have a mass. Well, it's a mass event in Idaho. It wouldn't be a mass event in the other urban areas. But we're saying, look, we want you to do that. We want to encourage it, but let's do a better job of managing it and not have everybody be saving vaccine for those events. Let's plan them out and more effectively get that vaccine out. I think this new dashboard is going to offer a lot of transparency there and help with that. But your health district, and I had the director and two of the board members in the office yesterday, they're at like 99% of getting the vaccine out. So it varies. There's some areas where I suspect that they're hanging on to vaccine because they got a lot of appointments Monday when the 65 and older population's there. I believe by the end of next week, a lot of that inventory will be run out, but we think the transparency is just a good thing for that everybody in Idaho has confidence in how the system's working. So the new executive order is just to give people comfort that there's not vaccine sitting around. We know of no vaccine that's been wasted. There's some of it that's in inventory that's in the queue, and that's why I put the 7-day number on it. We also put new resources out there to help motivate those people that are administering the vaccine to get it out.
And a quick follow-up, does the state know how long vaccines are sitting unused before they go into people's arms?
We're getting close to that. Not every provider is in, but almost all of them. The system that we're using is a system we've had for a long time. It's called IRIS. But I mean, when you get flu shots, when we do all these other shots, most of the providers, almost all the providers, matter of fact, to be a provider, you have to sign up for that. And to get the funding, you have to sign up for that. So we have that data. It's in some regions. And like I said, I think I know some of it is they're saving inventory to get people signed up for a big event. We want them to sign up for a big event, but we just want to be more efficient at that inventory and get it out, like I said, within 7 days.
Thank you.
Nicole.
Hi, Governor. Thank you again for taking the time for this. You spoke about making sure that the state is distributing vaccines equitably, and I'm wondering if Idaho is going to start tracking these vaccinations and collecting any ethnicity and race data. Of course, we're tracking that when it comes to actual COVID cases, and the tracking of this in other states has exposed inequities along, particularly low rates of Latinos, for example.
I'm going to have Director Jepson help me here, but my understanding is some of the record keeping in other states is prohibited statutorily in Idaho. That doesn't mean that we're not going to do everything we can to fairly get the vaccine out. We know that vaccine distribution in areas with big hospitals with bigger populations is easier to do, and that's why I inserted the word fairly as often as I could in the comments I just made. But Director Jepson could talk about the specifics of some of the limitations we have that are codified into Idaho law. Dave, do you want to talk about that?
Thank you, Nicole, for the excellent question. Yes, in Idaho statute, it's very specific what we can capture in our data system, our IRIS system, as the governor mentioned. And we are not allowed under statute to capture that demographic, that race and ethnicity data through that system. And so that makes the challenge a little bit higher to measure what's happening in that with our demographics across the state. We are committed to finding other ways to capture that data, and we are in active conversations with the health districts to understand other avenues we can use to capture that data, because we are committed to making sure, as the governor said, that this is done equitably and fairly across the state. And so we continue to work on that.
Thanks, Dave. Keith.
Governor, thanks for doing this news conference. Another question about the Biden administration. You said that Idaho is getting about 24,000 doses a week. In your talks with the administration, do you see that number ramping up much in the months ahead? And how much confidence in the Biden administration do you have for them to make that happen?
Well, of course, 25,000 first doses. Then there's another 18,000 second doses, Dave. Dave's off stage helping me out here. And of course, all the states are concerned about it. We all know that AstraZeneca and Johnson & Johnson are in the queue. Also, Moderna and Pfizer are being asked, and frankly, it's in their best interest to ramp up production. I just keep doing the math about when are we going to get to 70, 80% vaccinated to where we can go back to life as normal as all of us in Idaho want. And I think we're going to have, over half our population done, hopefully by spring, by late spring, early summer. But it depends upon those other two vaccines and where we ramp up. This first group, the 250,000 people we have that are going to start Monday, there's a lot of interest in that group. When we get down the age demographics, then the uptake rate is going to be lower, and it's going to take us a little more work to get out, but we will also have really perfected our distribution network. But it's in everybody's interest. It's in the pharmaceutical company's interest. It's in the administration's. Nobody is in the camp of saying we don't want to get as much vaccine out as quickly and safely as possible. So if there's things we can knock out of the way, barriers, we're all for that, but we have to make sure that the vaccine is safe. And that's why it's been a little delay on both the Johnson & Johnson and AstraZeneca, because FDA, under either the previous administration or this one, has a commitment to make darn sure that the vaccine is safe.
Along those lines, you received your first shot the other day. Did you have any adverse reactions? What are your thoughts?
No, unbelievable. I got a shingles shot a few months back, and believe me, the COVID-19 shot was a walk in the park. I'll probably make the shingles guys mad. Compared to the shingles shot I got a month or two ago.
Nicole again.
Nicole.
Thank you, Governor. I'm seeing a lot of public confusion regarding what type of identification or residency requirements are needed to be provided, whether to healthcare providers, whatever, to sign up for the vaccine, especially as we're moving more into a lot of people in the general public receiving the vaccine. I'm wondering what the state is directing healthcare providers, health districts as far as these requirements.
Well, Nicole, I'll let Dave talk about the intricacies of your question, but I can tell you they wanted to know what they wanted to know my name and my birth date, and they were also interested in my insurance card when I did my vaccine. But you know, the vaccine is all free. It is free, and on top of that, we're providing an incentive for the providers, $15 on the first dose and $25 on the second dose. I know of no barriers for anyone getting the vaccine. Dave, do you want to add on to that?
Sure, Governor. Up until this point, what we've really used is the groups that have been eligible have been through employers, and so the public health districts have worked closely with employers to identify those that are eligible. Moving forward, as we move into much more of this age-based approach, with any provider, as the governor said, the first thing they're going to ask is what your age is. It's, if you're with that provider already, they already have that information. And that'll be really the main mechanism that the providers will use to monitor if somebody is 65 or older or not as they come in for their vaccination.
Yeah, the one example I've received was, do I need a social security number? And do I need to provide my social security number? That's one of the most common concerns I've heard.
Well, they didn't ask me for my social security number, and I'll give it out here. No, I won't. But one of the other things is the 65 and older, almost every one of those are enrolled in Medicare right now. So they have a doctor and a contact. It gets a little more complicated when you get below 65. So. Melissa.
Hi, I have a follow-up for Nicole Foy's earlier question, actually. The racial and ethnic disparities in vaccine distribution is something I had asked about on Tuesday and heard the same answer, that this is something that Idaho is statutorily prohibited from collecting. I was wondering where in statute that prohibition exists, if that's something that the director would be able to point me to. I haven't been able to find it or get an answer from the department.
I'm sure he's got the code section right on the top of his tongue.
Actually, Melissa, I don't have that on the top of my tongue, so I will follow up afterwards directly with you, Melissa, to get you a code reference for that.
Well, along those lines, is that something either you, Director Jepson, or the governor would like to see change so we can start collecting that information?
Well, of course, when we get a little further down the road, there'll be a lot of data on what we need to do to make this. I would like to think and hope and urge that we are agnostic. That right now, all the people that are in A1 that want it can get a shot. Starting Monday, everybody 65 and older can get a shot, and then we'll go through those other priorities when we get down the line. But I know of no barriers other than the fact it is probably going to be less ethnic and going to be more location. It's going to be their distance from a big provider, their distance from a pharmacy that has a lot of capabilities. And, fair includes everything. And that's why I'm dedicated to fairness. If there's barriers there, I'm more than happy to look at them.
Thank you.
Eric.
Oh, hi, Governor. So I didn't quite hear this when you answered Nicole's question. When it comes to residency, is there, as you know, I live in a community on the border. I have lots of people that might work in Clarkston and Washington, or people might live over there, have a provider here. Is there any restrictions in that direction?
Well, I think they ask you, obviously at Clarkston, Moscow, Post Falls, Fruitland, all our border communities, they're going to ask. I haven't heard, and I don't know of, but I do know some people that are employees that work on one side of the state line on the other side, and if they're a resident here, they get their vaccination. And that's the way it is. But I don't know, Dave, do you know, we ask them for their address, but I don't know if somebody's in Lewiston, if they've got a Clarkston address because they're trying to avoid income taxes. I'm just kidding. If they're prohibited from getting the vaccine. Dave, do you know?
Yeah, so obviously part of the process of somebody signing up and getting an appointment is an address. However, we're not instructing the providers to turn people away. If somebody's got an appointment and is signed up and happens to live in Washington and work in Idaho, we don't want to get in the middle of that. So we're saying if there's no, we're not opening it up for anybody from any state to come, but we're also not putting a prohibition in place that would prevent a barrier for those that live in those cross-border communities.
Thank you.
Scott Logan.
Governor, sir, I want to make sure I understood correctly since I fall in this category. Starting February 1st, 65 or older are eligible. Did you say you expect that to be 250,000 people?
Yes.
Very good, thanks.
That's not how many you'll get the vaccine, but that's how many are eligible. On top of that, we've got all those in 1A, healthcare providers, public safety, teachers that are out there that are also, that some of them will be getting their second vaccine, some of them didn't get their first vaccine. So what's really important to us and to the providers is that people have the patience, that they try and get an appointment, that they show up for their appointment, they show up on time, and that'll make this system, because if I've got providers there and they've got vaccine ready and somebody doesn't show up, that just slows down the whole process. And we're continuing to build it out. But of course, I can only, right now, first doses, do about 24,000 a week. That number is going to go up. There's no question about that. That number is going to go out. But if everybody in that group shows up, plus the ones that haven't, it's going to be a while before we get there unless we get more vaccine from the feds, and I believe we will. I don't know that it'll demonstrably move the time period for everybody to get vaccinated past 8-10 weeks.
Thank you, sir.
Audrey.
Yeah, I was wondering if and when we do start getting a big influx of doses, what is the state doing to prepare healthcare providers to make sure they can get those doses in arms? I'm thinking back to with testing, early on it was the supplies, it was test kits, and then it became personnel. That was the bottleneck. And I'm wondering what we're doing to prepare to make sure that doesn't happen with this too.
Well, tomorrow I'm going to go look at some of these facilities. A lot of these facilities are really scalable. They can do 400 a day, they can do 800 a day, they could do 2,000 a day. That's one of the real advantages of having the National Guard, because they're logistics experts. You get the National Guard, the health district, the provider in the area, and then the one group that I haven't talked about much is the medical reserve volunteers, the people that have signed up that have been helping out in those communities. You add all of those together, and instead of giving one shot every 2 minutes, you could probably be doing one shot every 30 seconds. So these other events are scalable, and the one that I spent the most time at, that I'm going to go back to tomorrow, was in Kootenai County at the fairgrounds. But you can do these big ones and really scale them up. And then the other thing that I've been talking to the health districts about is in these smaller communities here in the Treasure Valley, the example I think of is my hometown and Payette and Weiser, that you could do a clinic at Emmett and then go to Weiser and then go to Payette and use the National Guard and the health district. And then you can really ramp up. If we get double, triple the amount of vaccine, I'm confident we can ramp it up. You got to remember that under my, some of the things I did under my executive order, I opened up a lot of healthcare workers, retired doctors and pharmacists, people that were getting licensed. The young lady that gave me my vaccination was a nursing student. So we have really expanded the workforce to do it, and we can scale that up. Nicole for a final question.
Thank you, Governor. Mid-February or whenever it's possible after the big 65 and up group is when food processing workers, other agriculture, big agribusinesses are scheduled to start having the vaccine. There's been ideas and mentions floated of possible big employer clinics or something to kind of address this big workforce. And I'm curious if there's any more movement on that. Have any big state employers committed to do something like that? I've personally seen the testing version of that through contractors like Crush the Curve. So I'm just curious if the state's made movement on that yet.
Yeah, absolutely, and Crush the Curve is one of the entities that's interested in doing that to go to a large employer. And one of the nice things about that, one of the problems is that, you know, if Brad and Nicole say they want to get vaccinated at the XYZ food processing, they've got the name, they can schedule the time, they can do everything, and they can make it seamless. Take one of their large areas where they've got the spacing, where they've got all those other things, and make it to where, you know, and what will be the big demand is there's some people that have some, you know, minor effects. A lot of people are going to want to have the vaccine on a Friday or a Saturday, and there'll be a big demand there. But there are an abundance of people that want to go in, partner with these larger employers, and we will do everything to accommodate them. But I'm also worried about the small employers that don't have that kind of scale, and we've got to do both at the same time. So with that, thank you all very much, and thanks for your questions.